Hello, my name is Paul Leong. I'm a facial plastic surgeon here in Pittsburgh, Pennsylvania, and I'm the owner of Sistine Facial Plastic Surgery. I wanted to describe a patient. You see some before and after pictures that I really think she's a great example of our philosophy of aging face procedures and the kind of results we can achieve. And so this very nice lady, she's 64 years old. She came into our practice and she just described that she felt vibrant, she felt energetic, but when she looked in the mirror, she didn't really see that vibrancy. And she wanted to sort of, in a sense, look how she felt. And so we examined her and described to her that there were 3 procedures that we could do that we thought would make the biggest impact. These 3 procedures are a face neck lift, an upper lid blepharoplasty or upper lid eyelid lift, and also some filler, some tear trough filler with Restylane L injected under her eyes. And let me tell you a little bit about these procedures. The face neck lift we did, our priorities are for her to look perfectly natural and to get a nice long-lasting result. A good facelift should last 10 to 12 years. And all different kinds of facelifts are not created equal. We use a very advanced technique. I give lectures about this technique in the United States, but also around the world, in Europe and in Asia, and you can see that in our video section. But this is a high smash, deep plane facelift technique. The key characteristics of this lift is it takes a bit more skill to do it. It takes a little bit longer to do it in the operating room, but the results are durable. They last 10 to 12 years, but the critical thing is the patients look natural. They don't look stretched or pulled. They don't look sort of the wind tunnel look or all the other things that can give away that you've had facial plastic surgery, and we don't want that. We want our patients to look perfectly natural. Then she had the upper eyelid lift, which worked out beautifully. It revitalizes the areas around her eyes. And then our philosophy here in this practice is that facial plastic work is not purely surgical or purely non-surgical. It's an intelligent combination of both. So in addition to those 2 surgical procedures, the face neck lift and the upper eyelid lift, she also had some tear trough filler under her eyes. And again, we used very advanced techniques. We don't ever inject fillers anywhere on the face with needles, as is still done many places. We use blunt tip cannulas that reduce the bruising, reduce the downtime, and make the procedure safer, and the cosmetic result, we're quite certain of it, much better. And so this nice lady demonstrates sort of the whole continuum of our philosophy. World-class surgical techniques linked to beautifully applied non-surgical techniques in a caring way with our patients that can result in what we see here, a completely natural result, a completely safe result, and a wonderful, happy patient.